Hello, my name is Ray, and my pronouns are he, him, and I am part of the Tennessee Transgender Task Force. Today, I will be speaking about subcutaneous and intermuscular hormone injections. You may have heard of these called SubQ or IM injections. When prescribing hormones, many providers expect people to do IM or intramuscular injections, but that is not the only option. In fact, there is growing literature that supports the use of subcutaneous injections for both estrogen and testosterone, and many providers are encouraging patients to begin performing subcutaneous injections when they first start gender affirming hormone therapy. Subcutaneous injections deposit hormones into a person's fatty tissue, while intramuscular injections deposit them into a person's muscle. Because of this, the needles used for sub-Q can be a ½ inch to 5/8 inch rather than the inch to 1.5 inch for intramuscular injections. Subcutaneous injections are usually performed in the fatty tissue of the stomach, thighs, or butt, and intramuscular injections are usually performed in the muscle of the thigh or the butt, even though there is a risk of hitting the sciatic nerve when injecting in the butt. Although it may take longer to perform the injection, a person may use a smaller gauge or thinner needle, such as a 25 or 27 gauge needle for injection. Being able to use shorter and smaller gauge needles can be more comfortable for people who dislike needles, and the shorter needles used for sub-Q injections can be less painful than those used for intramuscular injections. Many people say they often can't feel the needle go in and don't have any pain at all with sub-Q injections because the needle is so short and thin. Sub-Q also has the benefit of causing less scarring at the injection site long term. That is very useful because many trans people use injection hormones weekly or biweekly for decades. It is still worth rotating injection sites to prevent scarring when doing subcutaneous injections, for example, doing a different side of your stomach each week. One thing people often struggle with when injecting intramuscularly is that they need to keep their muscle relaxed while injection to make it minimally painful. With subcutaneous injection, because you're injecting into fatty tissue rather than muscle, it doesn't matter whether your muscles are tensed or relaxed while you inject. Some people often feel sore for a day or two after intramuscular injections, but sub-Q injections don't cause any muscle soreness, which is a big advantage for many people. Medical professionals consider sub-Q injections to be easier for people to learn to do correctly on their own than IM injections, and many other medications are commonly self-injected this way, like medication for diabetes. Even if your provider does not bring up sub-Q injections with you, you can reach out to them and ask them to teach you how to do it. There's also reliable guides online, including videos that show you how to do subcutaneous injections. If people are unable to obtain syringes for gender-affirming hormone therapy from a healthcare provider, pharmacy, or local syringe service program such as Choice Health Network Harm Reduction in Knoxville, trans people may be able to receive injection supplies through the mail via Transneedle Exchange at transneedle.org. To learn more about HIV care, please go to hivtn.net/TTF.